sites. We look forward to a conversation tonight, as well as we'll extend this conversation over the next several months as we move forward with our plans of looking at identifying and opening a supervised consumption facility here in Somerville. I'd like to start off by welcoming everybody, but I also want to welcome the Mayor of Somerville, Mayor Joe Curtatone. If you want to open us up with a few words, that would be fantastic.
Thank you, Doug, and good evening, everyone. Thanks for those tuning in who will view afterwards, and for those who are and will continue to be engaged with us. And it's a really important conversation. Before I go forward, I do want to recognize and thank the President of the Somerville City Council and the Ward 1 City Council, Matt McLaughlin, as well as Ward 4 Councilor Jesse Kling and others who have really led this effort to reduce harm and really see those who have a substance abuse disorder as a health issue and destigmatize it. This is an issue that we're all familiar with. We are in an overdose crisis. We've been in one for many years, even leading into the pandemic. Approximately 2,000 residents of the Commonwealth die every year as a result of overdose. Our goal as a municipality, as a city, is to protect our residents, to reduce harm, to save lives. And this is a crisis that knows no boundaries. It doesn't care about your economic or social status, your beliefs, your ideology, whether you're rich or you're poor, young or old. And for far too long, enough for full disclosure, there are folks in my family, maybe near and dear to me, who have a substance use disorder. And I'm concerned and fearful every day about the call I get. So as we have this important conversation as a community, as we present data, and you'll hear from researchers the city has been working with to complete a needs assessment and give us their recommendations on opening a supervised consumption site in the city. All I ask is that you keep an open mind and have an open heart and look at the data and the information. Just so you know, not too long ago, I was on the opposite side, clearly, of this argument. To me, it seemed counterintuitive. Doesn't this promote addiction, compound the problem? Aren't there issues involved with it? But what really changed me immediately was the data and the lessons learned from around the world. And you'll hear from some of that data where we have seen statistically significant data that shows massive reductions in those who perish because of overdose, and huge and statistically significant increases in those who seek recovery. We are intended really to keep people safe, to reduce the risk of harm, and to save lives. So once again, I ask you, as we have this important conversations, to ask questions, seek answers, look at the information, read it, and keep an open mind and an open heart. I do want to thank the Supervised Consumption Site Working Group, which has been meeting regularly to discuss community needs and explore how we could set the standard as we do as a municipality, and others around the country look to us to protect the health and well-being of our community. I thank you for tuning in, and I'll be listening with you and be part of the conversation. Thanks, Doug.
Thank you, Mayor. President McLaughlin, would you like to make an opening statement as well?
Yes, thank you, Doug, and thank you everyone for attending. I have to state up front that I have a hard stop at 7 o'clock today because I have a full council meeting tonight, but I did want to come for this important meeting as the city council president, as a resident of Somerville, and most importantly, as someone who has lost more people than I can count to opiate abuse. Almost everybody that I know who began using opiates when they were young are dead now. Very few survived. And it's just very important to me to start looking at a harm reduction model, look at ways to prevent death, to give people an opportunity to seek treatment. And the thing I've said often, as the mayor mentioned, this does seem counterintuitive, but the only thing less counterintuitive to me is continuing down the same path, doing the same thing over and over again, expecting anything to change. We've had a war on drugs going on many decades now. that, in my opinion, has not saved any lives. And this is about saving lives. It's about giving people the opportunity to seek treatment. It's not just about enabling drug use. It's about having people have the opportunity to stay alive until they are ready to seek help and seek treatment, and having those resources readily available to them. So I'm very excited about this process, and I thank the mayor and thank Doug and thank all the panel here, everybody who's trying to make this happen. It's going to be a long journey even from here. We have a lot of work to do, and we have a lot of convincing to do. This is not this is a counterintuitive thing, and we shouldn't dismiss any concerns people have. We should address those concerns and let people know that this is about saving lives and creating safer streets, not doing the opposite. So thank you.
Thank you. Both of you, thank you very much for your opening words and your comments as we move forward with this. So everybody knows what we're going to be doing tonight is I'm going to first introduce the panel, and those of you who are watching us, we'll introduce everybody you see on your screen today, or most of us. And then we'll start some of the presentation with some of the research that we have in here, and then move into learning a little bit more about harm reduction. And we will be closing up with questions and answers. Many of you had an opportunity to ask questions ahead of time and submitted those online. We thank you for doing that. Also, you will note in the chat function, you can also submit questions that way as well. And we'll be getting to as many of those as we can today. And if we're not able to address all of those today, we will be able to provide those into the future. And we'll be posting all of that information as well, like we have in the past town hall meetings. So with that, I'd like to introduce you to the people who you're seeing on your screen today. I've had the privilege of working with them for quite some time now, and it's been an honor. So I'm going to start. Alex, would you like to introduce yourself?
Yes, so thanks everybody for tuning in tonight. My name is Alex Collins. I'm currently an investigator in the Department of Epidemiology at the School of Public Health at Brown University, based in Providence, Rhode Island.
Great, thank you. Brandon.
Good evening, everybody. This is Brandon Marshall. I'm an associate professor in epidemiology at the School of Public Health here at Brown in Providence.
Thank you. Rachel.
Hi, I'm Rachel Bolton. I'm a Somerville resident and a member of SIFMA now. I also do outreach for the Material Aid and Advocacy Program, and previously did outreach for the Access Drug User Health Program, which is a harm reduction agency.
Great, thank you. TJ.
Hi, my name is TJ Thompson. I'm a member of SIFMA MA now. I'm also an organizer at MAP, which is the Material Aid and Advocacy Program.
Thank you. Steve. Steve, you're still muted.
Hey, so I'm Steve. I'm a member of SIFMA now as well, and also a material aid and advocacy outreach worker. I've also been a street outreach worker for a very long time. So thank you.
Great, thank you. And it's great to have all of you here to join us tonight as we begin this conversation. I'm going to actually hand this over to Brandon, who's going to introduce some of the research that's been happening, and then he will hand it over to Alex, who will really get into some of the meat of the information that we have, really looking at the data that we have and the data that they've been able to collect. And I do want to thank everybody who participated in some of the community participation areas, filling out surveys, and a variety of other opportunities to join us in this conversation and dialogue. As the president mentioned, this is a journey that we are on, and we welcome you to join our journey along the way. If you have to hop on, hop off, we understand that, but thank you for joining us. So with that, Brandon.
Thank you so much, Doug, for that introduction. So I'm going to share my screen. All right. Great. So as the mayor mentioned, Dr. Collins and I were contracted by the city to conduct a needs assessment report and feasibility study for supervised consumption services in Somerville. So what I'm going to do this evening is take a couple minutes to talk about what supervised consumption sites are, some of the research that's been done to support their effectiveness in terms of preventing overdose, limiting the spread of infectious diseases like HIV and hepatitis C, and saving lives. And then I'll turn it over to Dr. Collins, who will walk through some of the key findings from our work with the task force in Somerville. We'll also have plenty of time, as Doug mentioned, to answer questions at the end. We're thrilled to release this report this evening. I want to highlight that it's still in draft stage. We're going to take feedback that we receive following the discussion today, and also answer some of the questions that we may not get to in written form and include those in the report. You can download the draft version on the city's website, somervillema.gov/SCS. And I want to highlight as well, before I get into the material today, that this is the first step in a multi-phase process that will involve many community dialogues, engagement with stakeholders, and lots of other work that's ahead. And Alex will highlight some of the immediate next steps at the end of her segment of the presentation. So I want to start with a grim and shocking statistic that the mayor actually referred to, which is that over 2,000 people in the Commonwealth of Massachusetts died of an opioid-related overdose last year. And this is actually a 5% increase from 2019 and the highest ever recorded in the Commonwealth. Massachusetts now has the 8th highest rate of overdose death in the nation and 2nd highest in New England. And this one statistic can't possibly capture the incalculable toll that overdose has had on people who use drugs, their friends, their family members, and the entire community. So the true impact of this crisis is in fact much larger than this one statistic. The overdose crisis has not evaded the city of Somerville as well. Between 2012 and 2018, the number of opioid-involved overdose deaths in the city increased more than 5-fold. And although some progress was noted in 2019 and 2020, the COVID-19 pandemic has exacerbated this crisis in the state and nationwide. And so we're still in the midst of a major overdose crisis. In addition, other cities in Massachusetts are facing significant HIV outbreaks among people who inject drugs, which is happening alongside the overdose crisis in the state. And so that takes us to harm reduction. What is it, and how can we address these parallel crises that are happening in our communities? Well, at its core, harm reduction is a set of principles and approaches that aim to reduce the harms associated with drug use, as well as the harms resulting from racialized and punitive drug policies that we have manifested in this country for over 5 decades. Supervised consumption sites, or SCS, as we'll refer to them this evening, is one tool in the harm reduction toolbox that we can use to address this crisis. There are more than 120 supervised consumption sites around the world in almost a dozen countries, but no sanctioned facilities in the United States. You might also have heard of supervised consumption sites as supervised injection facilities or overdose prevention centers or overdose prevention sites. Fundamentally, these facilities are hygienic medical environments where individuals can consume pre-obtained substances under the supervision of healthcare professionals. Trained staff and peers are available to respond to an overdose with oxygen and naloxone and provide many other services like education, basic medical care, and referrals to other health and social services. These are 2 examples of what are called integrated supervised consumption sites in British Columbia, Canada. Under this particular model, integrated supervised consumption sites are located within an existing facility like a community health center or some other network of services that provides health and social services to people who use drugs and people who don't use drugs. Some of the other services that are typically provided at integrated supervised consumption sites are things such as counseling, case management, linkage to housing programs, basic medical services, and food provision. Facilities in Canada and around the world have been subjected to rigorous scientific evaluation. A wide variety of studies have shown that SIF are effective at reducing overdose deaths. In fact, no fatal overdoses have ever been reported in any supervised consumption site worldwide. One study that I was fortunate to lead that was published in 2011 in The Lancet found that a supervised consumption site in Vancouver led to a 35% significant reduction in overdose deaths after the facility opened in that city. Supervised consumption site use also reduced syringe sharing, which prevents the spread of hepatitis C, HIV, and skin and soft tissue infections, which can be very challenging and expensive to treat in clinics and hospitals. And finally, as was mentioned by the City Council President, supervised consumption sites increase uptake of treatment. They provide a pathway for folks. And in fact, studies have shown that the more often people engage in these facilities, the more likely they are to start treatment. There are also a lot of misconceptions of what supervised consumption sites do and don't do. Studies have looked at some concerns that many people believe might happen when we implement a supervised consumption site in a community. And they have shown that SCS do not increase the number of people who use drugs coming into a neighborhood. They also do not increase or change the amount of publicly discarded syringes or other kinds of drug-related litter. In fact, research has shown that supervised consumption sites reduce the amount of litter in public, thus improving the neighborhood conditions in which they are located. And finally, studies conducted in Canada and an evaluation of one unsanctioned facility in the United States finds that they do not increase harm, violence, or crime in the neighborhoods in which they are located. In fact, in both the Canadian and US studies, crime went down in these areas after such facilities were implemented. So I want to move now to the needs assessment that was conducted by members of our team and the Supervised Consumption Site Working Group in Somerville, who I want to thank tremendously for their incredible efforts to bring this all together. I'll turn it over to Alex in a moment to go through our main findings, but some of the major goals of this work were to determine the conditions under which a supervised consumption site would be useful and effective and suitable for people who use drugs in the city of Somerville. We wanted to determine the feasibility of such a facility in the city and look at some operational models that might be effective, like the location, the types of operations, and other programmatic features. And finally, we identified some concerns, challenges, and barriers through a number of surveys, which Alex will talk about in a moment. And we wanted to also look at strategies to address some of these concerns. So with that, I'm going to pass it over to Alex to walk through some of our major findings.
Great, thanks, Brandon. So for this whole needs assessment, we collected 3 different types of data. So we conducted surveys with people who use drugs as well as with the Somerville community. And we also did key informant interviews with people who use drugs. So I want to kind of hit some of the key pieces that came out of each of these types of data collection. And then I'll follow up with kind of our 5 recommendations based on this work. So the first survey I want to talk about was conducted with people who use drugs, and there were 47 individuals who participated in these surveys. The average age was 40 years old, and survey participants ranged from 19 years of age to 71. The vast majority were men, 53% of participants were white, and 87% of participants were unhoused at the time of survey. And so what we found in this work is that almost all participants who were surveyed said that they would use a supervised consumption site if it were established in Somerville. Just slightly over half of participants had had at least one overdose personally in the previous year. And 72% of folks did report daily drug use. And really importantly, 65% of people were using drugs outdoors regularly at the time of survey. Okay, next. And so we asked folks, if a consumption site were to open in Somerville, how often would you use it, or would you use it at all? And about 57% of participants said that they would use a consumption site in Somerville always or most of the time when they use. So it's a pretty substantial number. With some folks a bit unsure, they wanted more information about how it would operate and where it would be located before they could really make that decision. Next. And so additionally, we were able to analyze focus group data that was conducted by a peer researcher. And so there were 17 participants that were involved in 2 different focus groups that were held at 2 different drop-in service centers based in Cambridge that serve a large population of Somerville folks who use drugs. These participants were, again, the majority were white, 90% were men, and ages range from 32 to 55 years old. And similar to the survey that was conducted, the majority of focus group participants were also unhoused at the time of participation. And there were kind of 4 main buckets of services that participants highlighted that would be really important to have in a consumption site. The first is related to harm reduction services. And so while this included access to sterile syringes, to condoms, there was also this really big push to have access to drug testing technologies as well, in addition to harm reduction educational workshops. Social services were also deemed pretty critical for folks, and this included having on-site social workers, housing support workers, and having some community support groups like grief groups and other peer-based models of community support. Health services as well were seen as a pretty integral need to have in a consumption site. This included things like HIV testing, testing for sexually transmitted infections, being able to access medications for opioid use disorder on site, as well as being able to access hepatitis C treatment on site. And lastly, kind of the fourth major theme of programmatic needs that people raised was just to meet basic needs. So this included food provision that you could take away, as well as be able to have some food on site, and then have a space for people to nap and rest, because again, the majority of folks were unhoused. People also kind of highlighted barriers and facilitators to using a consumption site. In terms of what would help people go and access this regularly, people really highlighted this need for anonymity. And this is both kind of in their presence there in accessing the site, but also what the facility looked like. Did it blend in with the surrounding area? People didn't want it to stand out. They were concerned about being discriminated against or experiencing stigma. So having this facility kind of blend in with the surroundings, you could access multiple services there, so you wouldn't get kind of labeled as someone who uses drugs, was seen as a really important factor to helping people access the site. Having an interdisciplinary staffing model that included people who use drugs or people who had a history of drug use, medical professionals, as well as kind of wraparound support workers was also really stressed as necessary to have this mix of individuals working in all different aspects of the consumption site. Again, wraparound services, so having supervised consumption be one aspect of a much larger kind of breadth of services that were offered, was stressed by folks as being able to meet kind of additional needs. And then importantly, having support for multiple consumption methods, so not just injection, but also being able to support folks whose main method of consumption are through inhalation, ingestion, and or snorting. And importantly, there are 2 kind of main barriers that people raised. The first is related to law enforcement. People were concerned about being targeted when they were accessing the site or leaving the site, and they were pretty concerned about being arrested or being hassled by law enforcement in that regard. And also location. So people really needed it to be near public transit or near where they were currently staying. So, making sure that the location was accessible was a very important aspect. Next. And so we were also able to do a community member survey. So in total, we had 615 completed surveys. 91% of respondents were Somerville residents. We also included the other 9% of folks that weren't Somerville residents because they had a deep connection to Somerville. So either friends or family lived there, they were business owners, kids went to school. There was some kind of intimate connection with the city. 55% of folks were women. The majority of people were white, so 85% were white. The average age of respondent was 37, with the range being from 16 years of age to 78. And about a quarter of folks had lived in Somerville for 5 to 10 years. So next. So we asked individuals if they would be okay with a supervised consumption site being located in their neighborhood. And 56% of respondents said that they would have no concern. We also asked, kind of on a scale of 1 to 10, 10 being you strongly agree, how helpful people thought a supervised consumption site would be in Somerville. So in total, the average response was 8.23. So then we also wanted to look at how did that vary between residents of Somerville and non-residents. So residents of Somerville gave an average score of agreement of a 9.5, and non-residents gave an average agreement of an 8.14. And I will also say all but 2 neighborhoods have participant representation in it in Somerville. Next. The survey also provided a map of Somerville, and we asked people where they thought a supervised consumption site would be best situated. Individuals could pick as many locations as possible. But the 2 kind of major neighborhoods that came out of this was East Somerville. So 45% of participants reported East Somerville, and then 41% of participants selected Davis Square as being kind of these preferred locations to situate a site. Next. So what does this all mean? So in addition to these primary kind of forms of data collection, we also were able to analyze existing overdose surveillance data, data from the police department based on quality of life calls, as well as EMS runs for overdose calls. And we used all of this data to come together and build out kind of 5 main recommendations that we're going to share with you. Next. So the first is that we recommend that Somerville would benefit from at least 1 integrated supervised consumption site. And so again, an integrated site meaning that supervised consumption supports are one aspect, but this site also include a range of harm reduction, health, and social services. And this is really important because there isn't any existing brick and mortar harm reduction facilities or supports located in Somerville right now. And so having a site that's responsive to this need, not only kind of related to overdose prevention, but also just broader health and harm reduction supports is really important for Somerville. Next. And so based on this range of data, we recommend that a site be located in either Davis Square and or East Somerville. And so these purple markings are the quality of life calls made in 2020 to the Somerville Police Department based on hypodermic needles found in public. The darker the purple, the more calls that were in that area. The yellow that you see is a 20-minute travel time on foot and or transit. And so that's really the average amount of time kind of historically people will travel to access the site. So if you had a location based in Davis Square and East Somerville, you would really kind of capture all of the Somerville community. Next. Second, we really recommend that implementation and operation of a consumption site involve mechanisms that establish ongoing and transparent dialogue between the city, the site's operating agency, and law enforcement. This is really important. You can see that it's a key barrier that people brought up as being a concern to accessing this. Are they going to get targeted? And so having that dialogue be open, people know what it's about, and have systems in place for what happens if someone is arrested. You know, what's the process to deal with that? And that really needs to kind of start as early as possible and be this collaborative and iterative process. We also really recommend that people who use drugs be meaningfully included throughout this entire process. So that includes the planning of a consumption site, the design, the implementation process, and the operation of a consumption site. This is very important to build trust, to get people to come to this site, and to make sure that it's operating based on the needs of people who use drugs and are responsive to those needs. Next. We also recommend that the city use a transparent and community engaged process that is inclusive of a diverse range of stakeholders. So in this planning and implementation phase. And so we're recommending that it includes, again, people who use drugs, community members, families that have been impacted, business owners, really to get this kind of breadth of knowledge and expertise that can help guide the next steps of this implementation. Next. And lastly, we recommend that mechanisms be established for this ongoing monitoring and evaluation of a consumption site if it is established in Somerville. And this is important for one, making sure that the programs offered, the hours of operation, the policies, that all of that's actually meeting the needs of clients and it's having a positive impact on the health and well-being of clients. Then also looking at how this consumption site is impacting the broader community. And so having some very kind of clear-cut mechanisms for how that will kind of roll out, as well as how to get that information back to the community, is a really important step. And next. We also just want to kind of highlight, again, as Brandon mentioned, this is just one phase of a multi-phased project. So over the course of July, there will be 3 different community listening and learning opportunities that will kind of foreground various experiences. So the first will be individuals impacted, so those who use drugs and those with lived experience, as well as the harm reduction specialist perspective. Next will be kind of family stories and the impact of the overdose crisis on the broader community. And third will be business and neighbors and how a consumption site may impact them and any kind of questions and concerns related to the business and residential neighborhoods. And ongoing throughout this entire process will be partner discussion and outreach that's spearheaded by the existing Supervised Consumption Site Task Force in Somerville. Thank you.
Great. Thank you, Alex and Brandon, for taking the time to do this and presenting your findings today. I think we've all learned some important information out of here and real critical information for us to really have some conversations about supervised consumption sites and work on that. But one of the things we also wanted to learn a little bit about tonight is really talk a little bit about harm reduction, some of the work that's been happening in some of the community areas. Rachel, would you like to start this conversation? And maybe we can also ask TJ and Stephen to add a little bit of more information and details within some of the work that's been going on.
Absolutely. Thank you so much. So Brandon and Alex did a really nice job providing an overview of harm reduction as a philosophy of care and a set of practical strategies associated with drug use and aiming to reduce the harms. How that looks in practice can be anything from testing for HIV, Hep C, and sexually transmitted infections to providing new syringes and injection-related equipment. It also includes medications for opioid use disorder, methadone, and it's also providing education to the community. So a big part of outreach is providing information to the general public about ways to reduce the risk of having a fatal overdose and doing trainings so that everyone is equipped to respond with Narcan and oxygen to opioid-related overdoses. I believe that all of us are very equipped to practice harm reduction. That's what we've been doing with COVID, is figuring out how we can continue doing the things we want to do that may carry some risk in as safe a way as possible.
Great, thank you. Stephen, would you like to add anything around harm reduction work that you've been talking about and working within our communities?
I mean, she pretty much nailed it on the head there, but I will also just say that, you know, like I know it's intimidating for people to try to practice harm reduction themselves if they're scared of using Narcan incorrectly or something, but it's really, there is no incorrect way to do it. And it's just that simple. It takes 2 seconds to learn how to do. And I feel like it's been sort of a stigma of its own and it's like it's improper to tell someone that you might do it wrong because it's impossible to do it wrong. Just it's that easy. I don't know.
Thank you. And for people who want to learn a little more about Narcan or naloxone, the Health and Human Services Department does offer trainings in a variety of places, in a variety of ways. And we also make that available for individuals as well. And you can simply call our office through 311 and connect with our substance prevention staff, including Matt Mitchell, I believe, who's probably listening in tonight. And he can help with some of those trainings and set some of that up. TJ, would you like to add anything into that? If not, we can move into other questions as well. TJ.
Thank you very much, Doug. I think the only thing I would like to add to that is they did a great job of explaining harm reduction. And one of the things I've learned from doing outreach over the past year, especially during the pandemic, is the pandemic exacerbated the need for supervised consumption site more than ever. This is something that I felt very strong about before the pandemic. And some of the things that have happened and the social networks and the social safety, like the safety fallback networks that people had going into 2020 have crumbled, fallen apart, and people have lost a lot of the support systems they had. And going forward, I feel like this is very important, not only to take what we had before and move forward, fixing this and growing it, but to bring it back together because we have had an increase in loss of life and loss of life quality.
Yeah, thank you. I think those are important points to make within this. And I think as we look at this, when we talk about supervised consumption sites, there's a lot of questions that people are coming up with, and what we're hearing in any of the areas where we're at and talking about harm reduction, but also really talking about our community itself. And I'm going to ask the mayor maybe to answer the question, because I know that we've all heard this multiple times. Well, why Somerville? Why should Somerville do this compared to maybe where we know that there have been other higher rates of overdoses? Why pick Somerville?
Well, it's a valid and fair question. It's not about picking one community or the other. Why aren't we all doing this in the Commonwealth as not a pilot, but an implementation strategy? And I'll just share some context. Some of us on this call, many were at the State House the year before COVID, and we heard from the provincial health director from the province of Quebec in Canada. And so we don't have a piloting strategy, we have an implementation strategy because the data shows that. Somerville has rightfully viewed as a leader in thinking about progressively adopting policies that advance public health for everyone. Around that same time at the State House, I remember a statistic was shared with me as the chairman of the Metro Mayors Coalition in the Metro region, and as a conversation I've had with other municipal leaders who looked to Somerville as influential in this arena and others. The Secretary of Public Health of the state said to us, we had good news, only approximately 1,800 people died as a result of overdose this year. I don't know what was good about that. There's nothing acceptable about that. And reconcile those two statements in Canada and Massachusetts. We shouldn't accept anyone that they're going to agree, but we have our people dying in Somerville. And if there's one person dying as a result of overdose, we should be doing something about it. We have an opportunity to save lives and reduce the risk of harm across the spectrum and start a movement here that will have impact on our well-being, on our collective health, on our quality of life, and only add to what is seen as some of us seen as being a progressive leader. It makes sense. And we're part of one region, we're part of one Commonwealth, and I'd submit to everyone that once Somerville moves deliberately in this direction, if this is where we go as a community, we will influence a movement not just here, but across the country. I can't think of any greater opportunity for us to take here. And so that's why Somerville.
Thank you, Mayor. President McLaughlin, would you like to add comments to that as well?
Yeah, I just wanted to add to the comment about why Somerville. The first reason is because we have the will to do it. which is something that a lot of cities, a lot of states aren't willing to do. So we have the will to do it. And why Somerville is the opiate epidemic has directly impacted this city on a profound level. We go every year to the opiate memorial where we lay out hundreds of purple flags for Somerville residents who have passed away. If there's been any decline in overdoses in Somerville, it's because most of those people have died. And these things do come in waves, as you see, like every few years, every decade or so, there's a new wave of drug overdoses. There's a new wave of people who have to learn the painful way about the dangers of substance abuse. So even if we're at a lull right now, there's a huge possibility it'll come back. This impacts people across all economic backgrounds and races and genders. Everybody in Somerville, this is impacting people. And even if you're not a user, if you're not someone who knows someone who's addicted to drugs, if you go down to Statue Park, you'll see needles in the grass. We get 311 calls all the time about improperly disposed of needles at Statue Park, at Chuck E. Harris Park, places where children play, in bathrooms, porta potties. So even if this doesn't affect you directly, it does indirectly affect you. And what we're trying to do is to directly address these issues, not just for the people suffering from addiction and the people who know them, but for the people who have to deal with other negative health benefit aspects to this.
Doug, if I can add to that, because President McLaughlin alluded to something important here. There are consumption sites right now in our society. Now, you know where they are? They're in the porta potties. They're in the bathroom of a restaurant. They're in an ATM. They're in someone's basement. I will share you true stories from parents who were at those meetings at the State House saying, I've asked and begged my son or daughter to allow me to be with them when they use so I can take action. You know, I have Narcan. And this is why it's happening right now. We need to destigmatize and call what it is. This is a disease. This is a health crisis. And in any health crisis, we would rally together like a pandemic to keep our communities safe. So I just wanted to echo and add to the words of the president. This is happening right now in people's basements in our community. It can't be done in the dark alleys. And it works. It works when it's part of a deliberate, progressive public health strategy.
Thank you, both of you. I know bringing this home, you know, for all of us who live here is an important piece, and even recognizing that this epidemic has impacted all of us, whether we know somebody directly or we may know somebody else who is part of a family member. This all impacts all of us, and I think that's an important thing to bring it home all the time. One of the other questions that we often hear about, and I'm going to look to Alex and some of the research that you have done, and Brandon, to really answer the question, well, won't this just attract more people who use drugs into Somerville?
Thanks, Doug. I can take a crack at answering that question because I think it is a valid concern. And, you know, we have looked at this, teams have looked at this before and after similar facilities have been opened. And what those have found, and what Alex alluded to, is that the vast majority of people that use these sorts of facilities live or reside within 20 minutes, about 1 mile of the actual program. Very few people come in very far to use these at all. So, you know, what work has shown is that no, they don't lead to increased drug-related activities in areas where they are implemented. If anything, as I mentioned, they improve neighborhood conditions. Once a supervised consumption site is implemented, you'll see less people using in public. You'll see less injection-related litter discarded in the environment. So they actually contribute in positive ways to the neighborhood conditions and address some of the public safety challenges that we have been experiencing for over a decade now as a result of the opioid and overdose crisis.
If I may add to that too, a local example, we don't have a integrated consumption site here, but we have other facilities like halfway houses who help people bridge between their recovery for alcohol addiction section. I know firsthand because I used to be on the then called the Board of Alderman City Council about 20 years ago. One as well, Caspar opened up one in my neighborhood up in Prospect Hill. And I remember someone dropped flyers around the neighborhood claiming we're going to have increased crime. It's going to drive our property values down. And our safety is in danger. I can tell you firsthand with the statistics, in the 20 years, property values have gone up exponentially and crime has gone down exponentially. The people we're talking about are us. These are our friends and neighbors. They're family members. I haven't met one family where addiction or in this crisis hasn't touched them one way or another. And if we maintain the status quo, don't do anything, we're just compounding the death. More people will die, and we have an opportunity. In fact, there isn't not even a case that the data doesn't point to any increased crime or devaluation. The data clearly points that it doesn't result in that explicitly. These are good questions. We should continue asking, and you should seek the answers. But we have some examples here locally how have been progressively thinking in terms of public health intervention is mutually aligned with our community values, and the fears around that are not justified.
Thank you. Alex, did you want to add anything to that? If not, I do have a question that came in about the data and the representation on the data.
Yep, I think I'm ready for that one.
Great. So one of the questions that was asked in here from everybody is, are the majority of illegal drug users in Somerville white men? If not, why was the survey not more diverse?
That's a really great question. And so I'll answer it in two parts. The first is that we don't have data on who all uses drugs in Somerville, legal or illegal. And so for the survey, that is a limitation, is that it isn't incredibly diverse. We were working under COVID restrictions, so it made doing this work pretty challenging. Steve and TJ, who are on the panel, were incredibly helpful and were able to conduct about half of these surveys themselves. So there was an effort to reach out to as many people as possible. So we just need to remember, as we kind of interpret this, that we may be overlooking diverse needs, specifically needs of women and gender diverse folks. And so kind of in the next phase, as people are doing more outreach and as thinking through policies and implementation strategies, it is going to be very important to make sure that there's a bigger push to get a more representative sample of folks who use drugs.
Thank you. Before TJ or Steve, if you add to that, President McLaughlin, I know you need to step off for the City Council meeting. I want to thank you for being here, but would you like to make any last comments before you have to go do the work of President?
Yes, thanks, Doug. The work's already beginning. I can't, the beginning of the meeting sometimes worse than the meeting itself. But no, thank you, everybody. And, thank you, Mr. Mayor, for making this happen, for bringing it up. You will not be the mayor come January, but you've laid a lot of great groundwork here. And I'm hoping that the next mayor takes this up, and we'll make sure to hold them accountable to that as well. And I just thank everybody for your hard work on this. And I want to thank anybody in the audience who is still apprehensive or still has concerns about this. I don't want to ignore your concerns. This is a new concept. It hasn't been done in many places, but I think it's coming from a place of helping people. And whenever you take that as a priority, it usually leads to positive things. And the worst thing we can do is to do nothing and allow this problem to continue as it has. So thank you, everyone. I will jump to my next meeting, and I look forward to the next steps.
Thank you. We appreciate you being here.
Thank you.
So back to both of you with the questions about the representation in some of the data that's there. TJ.
Thank you, Doug. I'd like to say first off, I don't think you'll ever have a complete representation of data in any given city when trying to conduct a survey like this. No matter where you go, you won't have the full idea or of the span of what goes on behind closed doors or who is doing what wherever. What we were able to do in this situation, which as Alex said, was slightly limited due to the pandemic. Actually, I would say incredibly limited compared to what we could have done on a different year, a year before, or maybe next year, or even later this year, when everything wasn't so constrained to lock down. We would have more available outlets with outreach to be talking to more people. When these surveys were done, this was done in the winter of 2020 or 2021, when many people were not particular in the in a given space where we were able to reach out and talk to as many people as we would like. I know for a fact, I went out during snowstorms to deliver some of these surveys. I walked down hills to where I know people would be because of the outreach work that I've done. I knew where I could go. That would not normally be somewhere where you would conduct a survey, but I was able to do that because of my the affiliations of where I've done outreach work with. So I was able to get some more perspective than I usually would, but not the full scope of any given city, of any given data population. So we did the best we could. So like, as I've said, there were limitations. So that would be an answer to why. And there could be probably more surveys done in the future that would be more representative and go out a little bit further. Thank you.
Thank you. Stephen, did you want to add anything? I know you did some of this outreach and collection as well.
Yeah, it's just I basically what he said is all true except TJ. It was 2020. You had it right the first time. So I also want to say that I tried to keep it as diverse as possible, but it was just that it just seemed like there was mostly just, it was very hard to make it diverse in the communities we were going to. I'm very sorry about that.
Great, thank you. I also want to recognize that Megan Ackerman, who many of you may recognize her voice, is with us tonight, who's helping manage some of the questions. So I'm going to ask Megan if she could just review some of the questions and bring some of those forward for us.
Sure. We also had some questions that were submitted ahead of time that I'm going to go into. There were some that were asked multiple times a few different ways, so I'm going to paraphrase and try to only ask them once. One question was, how will outreach be handled to have folks know about the safe consumption site and that they won't get in trouble? Rachel, do you want to talk about how outreach would be carried out?
Yeah, thank you. So, I mean, outreach would look a little bit different depending on how, the community comes together and decides outreach looks. Like, we will have input from various different stakeholders, but I can speak to how I imagine it would work best and similar to other harm reduction approaches. So you approach people on the street and say basically, like, is there anyone in your life you're concerned about having an overdose? And then pivot based on how someone responds. So it either becomes handing someone more information about supervised consumption site with an invitation in, if that person identifies as someone who would be utilizing that service. Also, it's sharing information so that person can bring it home to a loved one who uses, a friend, a family, their place of work. So that information travels throughout Somerville and people know that it exists. In terms of addressing concerns about law enforcement and getting into trouble, the supervised consumption site would have a set of pretty clear policies and procedures with law enforcement. The recommendation from the report is that there's a strong partnership developed with the Somerville Police Department so that we, have an ability to work together and make sure people's needs are met. And so then it would be communicating what the expectations and address those concerns so that someone can make an informed decision how they want to show up.
I might just add on to that. I mean, a key piece that Steve and TJ and Rachel have highlighted is connections to people. And so that's why part of the recommendation is also to have the operating agency be an existing agency that already provides harm reduction services or other supports to people who use drugs, because having that relationship and that existing trust is really important to further those outreach efforts and to get folks in the door.
Great, thank you. Megan, do we have another one?
Yes, Doug, actually, I think this would go to you. The authors of the report recommend convening a community advisory committee. Who would be eligible to participate in that committee, and how would one go about getting involved?
Great. That's a great question. And thank you. And we welcome your involvement. So like other committees and in those that we have done, we will put a call out for additional members to continue to move this information forward and continue our work that we're doing here along our journey. So please keep an eye on the city's website. And of course, you can also, if you're interested in being a participant in this, feel free to reach out to me at dcrest@somervillema.gov. Or you can simply call 311 and ask for me, and we can certainly put you onto the list of interested individuals. Thank you for asking that question.
I think this would be a question for maybe either Alex or Brandon. What type of medical professionals would be present at a supervised drug use who could intervene in case of an emergency?
Alex, you want to take that one? Go ahead.
Yeah, so I think a really kind of effective model is to have a diverse group of staff. So everyone can be trained in reversing and responding to an overdose. So I think that's a really important piece. So we would recommend that the operating agency develop policies around, is there a nurse on site that provides kind of basic care versus being in the consumption site? Is there a nurse and a peer in the consumption site? I think that really needs to be kind of within the Somerville context and what would work best for people. But we do recommend that at least 2 staff person be on site at all times to be able to monitor and effectively respond to any medical emergency should it occur. But everyone is definitely capable of responding. So, it doesn't have to be an emergency medical service provider, for example. It can be anyone who is trained. So just having that training available is really important.
Great, thank you. I know that we have some questions coming in that I think because we have Alex and Brandon here who've done a lot of the research. You talked a lot about, or could you talk a little bit about areas such as Toronto and Montreal, where we already know that there's supervised consumption sites that have been in place and have been working? Are they working well? Also, what's the understanding of the neighboring businesses so that they're not disturbed by this, or how is this impacting some of the neighboring businesses as well?
Sure, I can take that one, Doug, and also maybe address the great comment from Aaron in the Q&A around the fact that the majority of the research has been conducted in Vancouver, which is an astute point, and it is true. But we do have other examples to look from, including Toronto and Montreal, but also smaller Canadian cities too, including my hometown of Kelowna, British Columbia, which is around the same size as Somerville. They've not been subjected to as intensive, large research studies as was done in Vancouver. The first one that was open, there was a lot of concern. And so a lot of research focus was spent understanding its impacts. But we have other models to look at, reports, evaluations, and so forth. And uniformly, they show that despite concerns that might be held by business owners, by residents, before implementation, really we see very positive impacts afterwards. They, especially smaller sites, the Vancouver site is very large. It's 12 booths, serves hundreds of people a day. Many sites, including those in Montreal, are much smaller. They really blend into the landscape of the city, so to speak, as was shown in those photos and was Alex alluded to. So most business owners that were interviewed in Montreal, for example, said, gosh, I wasn't even aware that it was open or had been functioning. And many commented, in fact, again, that they liked it. There were fewer people using drugs outside their businesses. So they actually felt like it contributed to a positive business environment in the neighborhood.
Great, thank you. Alex, did you want to add anything to that? I know that Brandon has really given us a pretty good, thorough understanding of that, but did you want to add anything to it?
Yeah, I can. So one of the examples we showed in the slideshow was the Dr. Peter Center, and it has only 3 kind of spaces in it. And they actually, when they opened, the Neighborhood Business Association was incredibly supportive and really kind of helped push the effort. It is located in Vancouver, but it's in a completely different neighborhood has no street-based drug scene in it. And so for the Neighboring Business Association, it was an important place to actually shift drug use that was occurring in the park in a very public way to inside, so people had space to go. So that's kind of a great example of working together towards a common goal, and then people being able to get extra supports along the way.
Thank you. Megan, is there another question that you've identified?
Yes, so here's one from the Q&A. Given that Davis and East Somerville have high need and that these two locations would combine to add total coverage of the city, is opening 2 SCSs on the table? If not, how will the city prioritize a location to open a first site? Will that relate to T-access, something else? And is the city considering a mobile site?
So I will start with that answer, and then I can let the mayor also add into this as we look forward to it. We don't know as of yet. I mean, I think part of what we really want to look at is what are the needs that we have in front of us, what's available, and how we're going to meet the needs of our community are really going to be the key components that we have in front of us in order to move forward with that.
I'll just add, and I didn't hear the whole thing, but I think I got enough of it. And there was another question. I'll just go ahead. Someone asked, will residents be able to vote on it? This will not be subject to a political or popular vote. That's what we get elected to do, to represent that and to trust us to follow the data and the research to make decisions for the benefit of the whole community. And when we're keeping everyone safe, the whole community is healthier and happier and more productive. So we're going to follow the science and the data. If we're going to, like anything else, if we're going to do something that leads and sets the standard for others to follow, especially to impact the community, when we want to have the most broadest and most positive impact on people, in this case, reducing harm and saving lives. So wherever that analysis and information data shows us will be the recommendation, like we always do, we will follow.
You can also add, we looked at the data, and because some of the overdose surveillance data from Somerville showed it being quite spatially varied over the years, we considered a mobile site, but people who use drugs responded that wasn't something they would necessarily want, that having a brick and mortar space that's, again, really kind of honing in on these other supports. A mobile site is quite small. You can't really do much in it that is kind of responsive to people's other needs. And so that's what we really are pushing in our recommendations, that at least one, but as the person who asked the question kind of noted, preferably 2 be added. And again, it's has this healthcare component and this social support component in addition to consumption.
Great, thank you. In the work that I'm just currently doing around the whole vaccination for COVID-19, we know that convenience is an important piece of this, and we want to make sure that we are not putting barriers up for people to utilize any of the services that we have out there to help individuals. So I think that's an important added component or view that we might also may want to look at. Megan, back to you.
Great. I'm actually going to combine 2 questions that were submitted earlier. What organizations are the city considering to operate the SCS, and how does the city plan to evaluate their candidacy? Seeing as there are currently no SCS in the United States, would we consult or contract with an organization that operates an existing site abroad? And would this site use any taxpayer money?
So I'm going to start with the first part about the idea and the question that we have regarding who would run something like this. Again, we don't know. Part of, and as you see in the recommendations, is to really make sure that it is inclusive, make sure the decision-making process is inclusive, including those individuals who will be utilizing the services and using these services to make sure that it meets that need. Does that mean that it's somebody like the Health and Human Services Department? Probably not. Does it mean it could be a different outside agency, a nonprofit agency that may be able to build on some of the services that are already existing? that sounds like it's a strong possibility. This is part of the work that we still have in front of us that the working group and the task force will continue to work on and bring those recommendations forward to the city council. For the question about funding, right now, what we believe and we hope that there will be foundation fundings that would be available to this. We also know that currently we are receiving some funding through our community benefits agreement with those who are using for the marijuana facilities, especially around the areas of medical marijuana. And now with the recreational marijuana is coming available, that may be another funding option for that as well. So we're looking at a variety of options for those funding supports. Mayor?
I'll just add, I think that's right. And we're not excluding any potential funding source, taxpayer or not. I'll just say, so I clarify, and we will give figures as best we can. Before we spend a lot of taxpayer money responding to overdoses and death, and responding to the failure of the war on drugs right now. So I'd submit, and it's a good question. We should have, and I appreciate this being brought up because reminding people that is important. Let's spend our resources to avoiding that worst case scenario and preventing it.
I would agree. Thank you. Megan.
Yeah, so another multi-part question. Doug, first, could you talk a little bit about what overdose-related health and safety initiatives currently exist in the city and what harm reduction initiatives we have? And then for Rachel, Steve, and TJ, in your outreach and harm reduction work, could you talk about how SCS fits in with that?
Great. These are great questions. So thank you. Please keep them coming in. And as a reminder, if we don't get to all of them, we will be posting these onto the same site as well. We're doing a variety of things. And again, as I talked about earlier, we have our prevention services unit here led by Matt Mitchell, who's doing a great job with that and has been able to access a variety of funding supports that we are getting. First, we recently received a grant from the Attorney General's office that is helping us expand some of the outreach programming that we are doing. So we're going to be partnering with Column Health to really do some additional outreach around opioid and especially around immigrant community members. We already are distributing Narcan. We've received grants where we're working with our Homeless Coalition and our partners over at the Homeless Coalition, as well as Fenway Health and Access, to deliver and supply Narcan to individuals, plus a backpack full of supplies for homeless individuals so that they're able to, one, get educated on it so they can be there and continue that network of safety that we have out there. Through the police department, we have our CORE program led by Patty Contente, who does an amazing job of doing a variety of harm reduction work with her staff and our community members, especially around those who may be impacted through the current system that's out there with our police department, and really making it a friendly face with them and building the partners and supports, and even a little bit longer of a care plan for many of those individuals, the individual plus the family work that we're doing. And of course, we work with the Somerville Homeless Coalition, a variety of our other partners such as Fenway Health, who also do our needle exchange program. We don't have a brick and mortar here in Somerville that provide the needle exchange. However, Fenway Health is our state contract agency who does work in Somerville, where we've adopted the needle exchange program and allow that to occur. Rachel, I think you can add some of those other services that we offer here because we work closely with your organization as well as I said, Fenway Health, Somerville Homeless Coalition, Column Health, and a variety of our other partners across the city.
Yeah, thank you. Somerville has so many resources for people who use drugs. I think that not all of those resources work for a lot of people. I think the approach is not always harm reductionist. And so thinking about ways that we can establish a brick and mortar harm reduction agency in Somerville to support people is really crucial. I think really highly of the work that Outreach did. That's been such a huge part of the work that I've done. I also it was me and one other person going around Somerville and doing outreach. And I think just as we've seen in the report, people in Somerville deserve really much more harm reduction and healthcare services. I also think it's important to mention that part of our outreach was to people who were in their houses and their homes and doing home deliveries, and also Narcan trainings at recovery homes. And so thinking about ways that people who are not necessarily, how we can engage people who aren't necessarily unhoused, but are using drugs and perhaps using a loan, and how people can get engaged with a safe consumption site to be able to be using in a safer way.
Thank you. And just as we all know, some of the areas have been shifting about where we're finding people using it. They are still doing it in the public, but we are seeing more and more people, and this could be because of the pandemic that we've had recently, is that people are doing it in their homes. But one of the challenges that we are facing is that they're doing it alone. And when they are alone, that's when they're increasing the risk of a potential fatal overdose because there's nobody there to be there to protect them. An exact reason why we're looking at a bricks and mortar place for a supervised consumption site as well. All right, back to you, Megan.
So before our next question, I know Mayor Curtatone wanted to just chime in one more time. He needs to leave us soon.
Great.
Actually, and I will try to start the answer on the question you're going to ask you, if you want to ask that question too, and I can start the answer on that and after Doug.
Sure. We've got some questions about law enforcement and legislation. So this is again a multi-part question. I'll read all three parts, and if anyone needs me to repeat them, let me know. What conversations, if any, have you had with local and state prosecutors? Oh, I'm sorry, it disappeared on me. Sorry, what conversations, if any, have you had with local and state prosecutors and other members of law enforcement? If the state legislature does not vote or pass SCS enabling legislation this year, will Somerville enact local enabling legislation? And given the legal landscape, is the city of Somerville willing to operate an SCS itself rather than relying on a non-governmental organization that may face more legal liability than a city-run facility?
Thank you for the question. I'm going to answer them. Please accept my apologies for leaving a little early. I have to head after something I'm scheduled for, but I want to at least kick this off. We are prepared to move forward on this as we were before the pandemic. We understand there's some legal challenges as there were in Philadelphia, and those cases evolved to the different appellate levels. We've had, going to specifics, initial conversations internally and some engagement with different levels of law agencies at different levels of government. Those will continue. We're well aware of that. We've also we're well prepared to fight the legal fight based on where we believe the law lies and falls. And yeah, we are prepared to do, and I'm prepared as long as I'm here to help lead with all of you in this community to move this forward. You know, I've heard, you know, there are rights in this country. I think everyone, you know, I believe in the right to people to live healthy, happy lives and not die if we can help avoid that. And we have the ability to do that. People have a right to exist in our communities, our Commonwealth, in this country. And I believe the overwhelming majority of people, certainly in this city, understand that. And I won't debate a legal challenge here, and I'm sure there'll be one. We're prepared to take that head on, and I'm confident in the arguments we'll make. And there's ways to go. We want the legal agencies of the county, Commonwealth, and the nation to be aligned with us in this endeavor. And I'm grateful there's a much more open and friendly administration in Washington under President Biden and the Justice Department on that. So I think we're in a much better place on that, from that perspective than we were 2 years ago. But it's not going to slow us down. But we will dot our I's, cross our T's, and share that information as it evolves with the community. I do want to, and I apologize, Doug, if you don't mind, to supplement what I may have missed on that question, but I do have to run out. I look forward to further conversation with the community. This really is a community-wide, locally and globally crisis. It needs a community response. And again, once again, ask you, these questions are very valid, very fair. Keep them coming, and with us, seek the answers and keep an open mind and an open heart. I know you will. And I look forward to that engagement. Appreciate everyone's work, and I apologize I have to jump off a couple of minutes early. So good night. Thank you.
Thank you, Mayor. We appreciate your leadership. I can add a little bit more, and perhaps others can too, around some of the legal areas and the work that we've been doing. We also know that even at the State House, there's been work in a commission that's been put together that really does support the potential of trying to do a pilot for a supervised consumption site someplace in Massachusetts, yes, being one of the leaders in that. So we know that some of that has changed from the previous administration, a federal administration, of what that looks like, and really trying to move us forward. We want to be ready to go if that were to change. I think that Somerville's a great opportunity, has a great opportunity in front of us to really be a leader in that, like we've been a leader in so many other things. So there's more to come on a lot of that work. Will there be challenges? There probably will be challenges. But as the mayor had stated, and clearly stated, that Somerville's up for that challenge. So, Megan.
Yes. So we got a question about our outreach and if it has extended beyond folks directly impacted by the overdose crisis.
I can take a first stab at that. Is this for longtime residents question?
Yes.
Okay. Yeah, so part of the existing task force for a supervised consumption site, it's been broken up. People kind of volunteered to go into different subcommittees. One of the subcommittees is community outreach, as well as communication, program development, and kind of legal and legislative. So there have been efforts. Again, COVID has made it pretty challenging for folks over the last year and a half. But there have been efforts thus far to really kind of reach out more to kind of longer term residents or full folks that have lived in Somerville their whole lives or multi-generations. And so that work will continue on. That's really kind of phase 2 of this work, is kind of a deeper effort to keep reaching out to different subpopulations of Somerville and talk more about these issues. And I will say about 25% of the folks that did participate had lived in Somerville between 5 and 10 years. So while that's not the 20 plus years, it is a good kind of people that have some roots in Somerville. But yes, additional efforts will definitely be taken in phase 2, really spearheaded by the task force.
Well, somebody's not quite at the 10-year mark. I'm getting really close. I think I'm only a couple of months away from that 10-year mark, but it is an interesting one to see. And I'm glad that we had a lot of participation from our community members. Megan.
Yes. So one question asked about, the presentation did a great job of showing a lot of the pros of SCSs. Are there any cons, and what might those be?
Yeah, thank you for that question, Megan. I was fortunate to serve on the scientific evaluation team that was researching the supervised consumption site in Vancouver known as Insight. And we were very concerned about cons. We wanted to look as scientists at both the benefits and potential drawbacks of these types of programs. So we did a number of studies. We had research assistants go out before the facility opened, count the number of people that were using, the amount of litter that was identified, and do that same thing again, and found reductions, as I mentioned. And then several studies have looked at crime, use patterns, which are typically unaffected or go down. So we did look at potential cons and did not find any in the studies that have been conducted so far. I want to mention as well something that goes back to an earlier point, and I'm sorry, I didn't realize the Q&A isn't viewable to the audience members. Aaron asked about, the fact that since so many studies have been conducted in Vancouver, how can we, think about them in the context of Somerville, which is very different. As I mentioned, there are other models, other evaluations that we can look to that are smaller facilities And then the other thing to keep in mind too is that the studies that were conducted in Vancouver were at a certain time and place, and we're in a very different context now, particularly when we think about treatment, especially for opioid use disorder. When we conducted the studies looking at uptake of treatment among clients of Insight in Vancouver, buprenorphine, which is highly effective at treating opioid use disorder, hadn't even been approved by Health Canada. We were really looking at uptake of things like detox. And so now I really feel that if you were to do those studies again, you would likely see even stronger links and more significant uptake of treatment, just because there's more options available to people now. And so, it's important to think about the studies that were done in Vancouver, both their potential limitations in terms of what they mean for other contexts, but also think about when they were conducted and how different the context is today.
Great. Thank you, Brandon. I know that we're coming close to the end of our time that we've allocated for this tonight, and there's many more questions, and we'll post those again on our website, so you'll be able to do that. And you also can certainly submit some additional questions that you may have. But before we do that, I do want to reach over to TJ and to Stephen and to Rachel a little bit about some of the upcoming work, especially around some of the outreach to get additional information and what work you are doing that may help us gain additional information to help us on this journey. TJ, can we start with you?
Sure. One of the things we've really been waiting for, being on the task force for the past year and a half, so we compiled information, we did the surveys, we've looked at the data, we've talked to people, we've done focus groups, we've done a lot of this stuff. So we were all the while compiling this data to put for Alex and Brandon to come before this report for the city. And so one thing we've been doing is patiently waiting for this report to come out and for the community members of Somerville to see this and respond to this as we progress with our next steps, because now we have their direct recommendation from the report to the city. So we have in place, as Alex mentioned earlier, we have 4 subcommittees that have been working behind the scenes, getting ready to move forward and implement things as things continue. First off, as the pandemic starts to lessen out, and and now that the city has the information, as we move forward with the city. So one of the big things is going to be community outreach and education. So now that you folks in the audience right now are reading this and hearing this and having these questions, we will be there from now moving forward, not only to answer these questions right now, but to continue answering these in other settings, other smaller living room settings, in small family groups, more community groups should be determined at this point. There are 3 now that Doug and the mayor have put up at the beginning of this meeting. And this will inform more and more, first off, community outreach. So we'll have more input to go forward with this. And as far as outreach, as for participants that may use these facilities, we will be, and other parts of this behind the scenes, continue to talk and develop ideas from them and continue to work as this process moves forward.
Great, thank you. Rachel or Steve, did you guys want to add anything additional onto that? Okay, great. Well, looking at a time, Rachel, did you want to add something?
Oh, I was just going to say that TJ did a really nice job doing the formal structures of outreach. And also, I think that all of us are having these conversations with people all the time. I know that I went to a clothing swap the other day and we were talking about supervised consumption sites in Somerville. We do surveys with people who are unhoused. We're having conversations about whether or not people would be interested in using supervised consumption sites. So I think that these conversations are happening all over all the time, and that it's really important that you all audience members take what you've learned from this and continue to have these conversations, because it's so important that we have this in Somerville, and it's going to save so many people's lives.
Great. Well, thank you. Looking at our time, we are out of time, unfortunately out of time tonight, because it's been a great conversation and we've gotten some great discussions. I just want to take 2 seconds to thank Alex and Brandon and Rachel and TJ and Stephen and our behind the scenes individuals, Megan, Juliet, Dan, for all of your work, and Ben for all of your work on making tonight possible for all of us. I also want to thank all of you out in the audience tonight who took an hour and a half of your time to sit and listen and hear this really important information and be part of this journey. We still have some roads to go in front of and to continue to move down that pathway, but we will get there. As we all have talked a little bit about, we have some upcoming meetings, which will also be posted on the website as well. Tuesday, July 13th, really talking to some individuals who are impacted by this. Stories from the field, stories from individuals, and learning a little bit more about that. Then on the July 22nd, we'll be hearing family stories and talking a little bit about community impact. All of these will be also around the whole idea of what is harm reduction and making sure that we continue to listen and hear from our harm reduction specialists that are out there. And then finally, on the 27th, we are planning to do a meeting with the businesses and neighbors. What kind of an impact will that have on our supervised consumption sites, but also what will the supervised consumption sites have on neighborhoods and businesses, and having a chance for an open dialogue there. As we keep talking about, this is just the beginning. We continue to go down this this pathway and this journey to look at what Somerville can do to really take the next steps of opening up a supervised consumption site. It's going to be a journey, and we welcome all of you to join us. And as Rachel mentioned, and TJ just briefly mentioned as well, that these conversations are happening all the time. We encourage you to take this conversation to others that you have in your neighborhood and others you have in your family, and bring them along to the next couple of meetings. Get engaged, get involved, bring your views, bring your ideas to us so that we can do this as an inclusive process. But most of all, if you know somebody out there who needs some support or needs to make sure that they understand what it means for an overdose, if you need to be trained on Narcan, please reach out to us and we certainly will help you get trained on that. And we'll also provide you some Narcan so that you have that available. We can all save lives. It's very simple. You carry it with you. And if you need it, you have that available. So tonight I want to say thank you to all of you. Thank you to the mayor, to President McLaughlin for being part of this panel and being part of this conversation. And we appreciate all the time you spent with us. For that, thank you and have a good night.